Afternoon. Once again, this is the first of a four-part series on exposing racisms. And the first in this series will be environmental racism with Professor Binka Coker, from the Health Sciences Department here at Gettysburg College. Um, the one very unique thing about this series is that every speaker from here on out will be a Gettysburg alumni. So I encourage you all, if this is the only one that you registered for, to register for the rest as you see the marketing for them, because um, it will be very exciting and very engaging with our alum. The other topics will be individual racism, institutional racism, and cultural racism. And as I said before, this is the first, which is environmental racism. So what we're going to do, I'm going to read the bio for Megan, and then I will pass it off to her and she will begin. We're going to have about 25, maybe 30 minutes of her presenting on the topic, and then we'll spend the rest of the time in discussion. As you all know, this will be recorded for those that aren't able to join us today, and will be on the college's YouTube page, but I'll be emailing it out to everyone that registered directly in order to get it. So we'll get started. Megan's work focuses on household air pollution and the health impacts of exposure to biomass burning. Dr. Binka Coker has studied household air pollution in both urban and refugee populations in Ethiopia, as well as in rural populations of Honduras. Her doctoral research explores exposure characterizations of household air pollution from biomass stoves in Honduras. She evaluated the ultrafine particles, nanoparticles, number concentrations in the homes of families using biomass cook stoves. Additionally, she explored the association between household air pollution exposure and markers of exhaled nitric oxide and markers of systemic inflammation. Her career path: Dr. Binka Coker received her Bachelor's of Arts from Gettysburg College and in Pennsylvania in Health Sciences and Globalization Studies in 2009. During her undergraduate career, she had the opportunity to study abroad in Uganda, and this sparked her interest in global public health. In 2011, she earned her master's degree in public health from Emory's Rollins School of Public Health in global health with a concentration in community development. She also received a graduate certificate in complex humanitarian emergencies from the Center for Disease Control and Prevention. And last but certainly not least, she received her PhD from Colorado State University Environmental Health and Epidemiology. So without further ado, I will pass off our afternoon to Megan.
All right, thank you, Monique. It's great to be here on behalf of Gettysburg alum and now faculty. So Monique reached out, given my work on environmental issues. Primarily I focus on public health, but there is a lot of overlap, of course, in what we do with public health and social determinants of health, as well as environmental racism. So I'm going to share my screen so you can see my slides. All right. So if I can get it to go. What I'm going to do is, as Monique said, sort of give an overview of what environmental racism and also environmental justice are, and then open it up for discussion. Again, I focus primarily on health, so this is slightly outside, I guess, my expertise, but I think it's something that we all should really be thinking about on any given day, but especially with sort of what's happening in our country right now. So as an overview of what I'll discuss, sort of just give a broad definition of what environmental racism actually is, and then I'm gonna share a few examples. So primarily they have to do with health. So examples from lead, air pollution, and then a little bit of what's happening with COVID-19 and the current pandemic, and then really sort of just open it up so we can think about, what can we do about this problem? What have people heard? What action steps can we take in order to try and make some sort of change? And much of environmental racism, as you can sort of see in this picture, is really thinking about the places where we live and work, our neighborhoods. And as you'll see in some of the examples, a lot of environmental racism is tied to specifically to neighborhoods, to schools, communities, and homes where people live. So by definition, it's a little bit wordy, but just so it's out here and we're all on the same page, it's the racial discrimination in environmental policymaking and the enforcement of regulations and laws. And really this is due to the deliberate targeting of communities of color with toxic waste facilities, sanctioning of life-threatening presence of these poisons and pollutants in communities, and the history of really excluding people of color from leadership of various ecology movements. To put that a little bit more simply, environmental racism refers to any policy, practice, or directive that differentially affects or disadvantages individuals, groups, or communities based on race or color. And it's important to note that this really can be intended or unintended. Both have the same impact, although you could argue maybe intended is a little bit worse, but the unintended racism is also very important. So it can be caused by a couple of different factors. Again, intentional neglect of communities of color, sort of this perceived alleged need to put pollutants in specific areas, specific urban areas where people of color live, and a lack of institutional power and the low land values among communities of color. And what I'm really going to present and outline is just some well-documented facts that we can sort of base a conversation on, that communities of color and low-income communities are disproportionately impacted by pollutants, specifically by industries, often sort of hazardous waste facilities, and just overall lax regulations of these industries. And from there, we can hopefully have a discussion about what this means. So I'm going to provide a couple of examples, and the first is something called Cancer Alley, and maybe it's probably the most famous example, maybe up until the Flint, Michigan crisis. But in parts of Louisiana, sort of an 85-mile stretch between New Orleans and Baton Rouge, there's a very predominantly African-American community. And this area has been completely overrun with different kinds of plants, industries, and refineries. Anywhere between 100 and 150 different types of chemical companies are working in this area. And they make really harmful chemicals, things like vinyl chloride and something also called chloroprene, which is listed on EPA's registry as a cancer-causing agent. It's the only place in the US where this chemical is made. And studies have shown that residents who live near the chemical plant that makes chloroprene are up to 800 times more likely to develop cancer than the national average. And from an epidemiology standpoint and public health standpoint, this is just completely astronomical. And it's also very difficult to prove, but if we're saying that these communities are 800 times more likely to develop cancer, then there is something drastically wrong going on. And so most of the communities living in this area are African-American communities. And so this is an example of environmental racism where chemical companies have built their industries right next to communities of color. And you can't see this here, and I don't think I'm gonna play it on the Zoom session, but hopefully when these slides are posted, it's a 3-minute video. I like to show videos in my classes because I think other people can tell their stories better than I can about some of the community members living in this area called Cancer Alley, and sort of the impact that it's had on their families and their inability to actually sell their home, to move, and to get out of this area. So environmental racism has been combated with the environmental justice movement, which began in the 1980s in the US. And environmental justice is this principle that really all people and all communities are entitled to equal protection of environmental and public health laws and regulations. I've also included, there'll be a bunch of links in this video, and somehow I could also make a fact sheet or something to circulate, but there's 17 different key principles of environmental justice that you could look at that outline sort of all the specifics. But sort of what I want to focus on is that environmental racism, I don't think we hear the term very often, but it's really nothing new, especially in the US. And we see that race is the most significant predictor of people who are living near contaminated air, water, or soil. And so communities of color and impoverished communities are more likely to live near toxic waste sites. So 56% of people living near a toxic waste site are people of color. They have 38% higher nitrogen dioxide exposure, which has negative health consequences. And they may be 2 times more likely to live without potable water and modern sanitation. And if that's not bad enough, we also see that these communities are exposed to higher pollutant levels, but when they try to make claims to the EPA or to other regulatory bodies, 95% of those claims are not heard or are denied. So they don't even have a voice in trying to stop these pollutants from impacting their health. So mostly I'm going to focus on African-American communities in the examples, sort of given what's happening with the Black Lives Matter movement. But I think it's important to point out that this is not necessarily tied to one minority group, and that depending on where you live, all communities who are in the minority category are differentially impacted by environmental racism. So in places like California, where there's a larger Latinx community, they are also impacted quite heavily, as are indigenous communities, either on reservations or just living in communities themselves. They're all taken advantage of in terms of being exposed to environmental pollutants at a greater rate than the white population. And again, this is not necessarily tied just to the US. This happens all over the world, and we've seen plenty of examples from indigenous communities in South America and all over the place. So it's not tied to just one minority group. And when we think about public health as well, there's often a very difficult job of disentangling the role of social class and race. There can be heavily tied together, but I think the examples that I'm trying to show before our discussion hopefully will show you that race is actually a larger determinant of environmental injustice than just your social class or your income. So racism trumps class in that even middle American or middle income African-American families are more likely to live in polluted neighborhoods than low income white families. So race is actually a much more important factor than income. And this slide is sort of the big takeaway slide, and I sort of hate that some of this becomes lectury, but given my academic background, I'm going to show a couple of studies that sort of try to make this point. And so here it's looks maybe a little busy, but what this slide is showing is a study that was conducted and looks at some EPA data, and they've tried to make the slide a little bit easier to understand and created on the y-axis over here some sort of toxic concentration value. So what you might be exposed to in terms of a toxic substance, and then use census data for income level across the x-axis. And so they collected some toxic release inventory data from the EPA and classified sort of the amount of pollution that was emitted from different factories and plants. And these included 7 different types of categories. So when we think about industries that are polluting and causing potential harm to communities. We can think about things like manufacturing, metal mining, coal mining, electric generation facilities that combust either coal or oil, chemical wholesale distributors, petroleum terminals, or even bulk storage. And overall, their toxic concentration value considers about 600 different chemicals. And what they did was basically just compare what folks are exposed to in different census groups across income levels. So they have broken this down by Black families and white families, and they're showing the toxic concentration value for each of these communities. And what this slide is really trying to show us is that environmental racial inequality is not actually a product of income inequality. So if it were, we would see that Black and white families in the same income level should be exposed to the same average toxic concentration values. But what you see is that for all levels of income, so controlling for income, we see that Black families are exposed to much higher levels of toxic concentration than white families are. And I think the other thing to point out is that, excuse me, up until about like $50,000 worth of income, white families tend to have, like this line is not decreasing all that much. It's fairly steady in terms of what they're exposed to. Whereas you really see a downward trend where income is important, again, among Black families, but it's at a much higher rate than white families. So they're exposed to much more at lower incomes, and it decreases with increasing income. And some of this might be due to the fact that as families earn more money, they're able to move away from neighborhoods that are exposed to more pollutants. And I think the main takeaway from this slide for me is really that if you look at Black families who make $50,000 to $60,000 a year, they're still exposed to much more toxic concentration in these words than white families who make less than $10,000 a year. So what people are exposed to is in part due to income, but in a greater part due to the race of their community. And some of this has really been set up by the history that our country has faced with housing. And this is where I am not an expert, and we have people on the Gettysburg College campus who are, in terms of thinking about housing and race. And so hopefully we can bring them into the conversation at some point, Professor Redden. And so I'll give the basic overview, and she can maybe fill us in at some other points. But the way that housing system has been set up in the US from history is a deliberate segregation of African-American communities from white communities. And some of this is called redlining. So neighborhoods where African-Americans lived, in order to get their home loan, they were sort of working with this homeowners loan corporation, and they would classify neighborhoods as sort of safe or risky for mortgage lenders or bankers to insure mortgages. And what they did was they created these maps where in various cities, and there's a link here as well, which I can put into some sort of fact sheet, but you can look at multiple cities across the US and how their maps looked in the early 1930s. And so they would sort of grade neighborhoods based on how risky it would be to lend someone money for a mortgage. And so they would rank them from A to D, where A would be not very risky and D would be considered hazardous to provide someone a home loan in this neighborhood. And if you overlay this with sort of population demographics, it's really neighborhoods that were colored red had African-American families living in them, and they were termed to be hazardous for getting a home loan. And it's the case that even a single Black family in a middle-class neighborhood could turn the entire neighborhood into sort of a risky investment for bankers. And what this did is that it prohibited African-American families from buying a home. And even in 1968, when the Fair Housing Act was passed and banned discrimination in real estate practices, we still see today that African-American families own their homes at a much lower rate than white families. So about 43% of African-American families today own their home compared to about 72% of white American families. So some of these policies have had really long-term impacts on African-American communities, and they've also therefore had an impact on African-American equity and wealth. So we know that middle-income white families, much of the wealth has been sort of accumulated through equity of homes, from grandfathers to parents and then to children. This equity builds over time, and African-American families have not had this opportunity given that they were not allowed to purchase homes. And so we see that African-American wealth today is only about 5% of white American wealth. And this can have, of course, detrimental impacts on these communities as well as their neighborhoods. So I guess much of this is tied to housing, and this lead example is also tied to housing as well. So in terms of exposure to lead, this is something that we hear about, I think, in the news, and we've heard about with Flint, Michigan, that families and children especially are extremely vulnerable to high lead levels. And so according to CDC, there's really no safe level of lead in your blood, and lead poisoning can have long-term permanent damage, especially for children, especially under the age of 5. And we find lead paints specifically to be in homes that were built before 1978, and we can also have lead exposure from water. And again, this all ties back to housing practices. So according to American Healthy Home Surveys, about 37 million homes in the US have lead-based paints, which can be a hazard. Gettysburg, I think we have a lot of homes, they're old, they have lead-based paints. There are things that you can do to mitigate this lead exposure. And this equates to about 1 in 3 homes with children less than 6. So if we're concerned about children, there's a lot of children in this country who are potentially exposed to high lead levels. And of course, it's in this presentation because the risk of this lead poisoning falls disproportionately on minority children. So Black children are 3 times more likely than white children to have elevated blood lead levels. So the CDC has set this at 5 micrograms per deciliter, but really no level is safe. And some of the exposure among low-income and African-American children is due to rental housing and also due to housing choice voucher programs, federal programs, and Section 8 housing. So the Housing and Urban Development HUD, we can see sort of a map they put out in Chicago, and they've stated that about 62,000 public housing units are in need of lead abatement. And so if we look at Chicago, and sort of the map on the left shows the number of housing choice voucher households, with the darker red meaning that there are more households in that neighborhood who receive these vouchers. And the graph on the right shows the overlap of children with elevated blood lead levels. And you can see roughly that they sort of correlate. So children living in houses who are using the federal housing choice voucher programs tend to have higher blood lead levels. Part of this is because HUD, they have a definition of lead poisoning, and their definition is actually that lead poisoning is of concern when it's greater than 20 micrograms per deciliter in a single test, or 15 micrograms if the tests are taken 3 months apart. And so that's significantly higher than 5. So their guideline isn't even what it should be in terms of CDC's impact on health. And that HUD also does not require any sort of pre-rental lead hazard risk assessments for housing choice voucher programs or Section 8 units receiving $5,000 or less. So they might not even require risk assessments or for renters to be notified that there was lead in their homes. And if the units have more than $5,000 worth of spending, then they are required to show some sort of risk assessment. However, the enforcement of this policy is very disjointed and often is not done. So again, housing is playing sort of a key role in some of these environmental racism topics. And so a study that was actually just published in February of this year tries to show again that it's not just your income level that's a factor in being at risk for high lead levels, that it really is a social condition as well. So African-American children living in homes that were built between 1950 and 1977 are 6 times more likely to have elevated levels of lead in their blood than white children living in a building of the same era. So taking into account the house that they live in, their income, they've actually shown that African-American children are still more likely to have toxic levels of lead in their blood. And some of this has to do with potentially unequal enforcement of these environmental regulations by housing authorities or by local governments, some emission standards issues, and remediation efforts, and discrimination against African-American communities. Some of the social racism factors might also play a role in terms of African-American households being sort of at risk or have fear of being evicted or have complications with landlords, and so they're not being treated equally as white families with low income. So the other lead example is, of course, from Flint. And here, this was not lead paint, but lead pipes. And so Flint, is about 60% African-American. And we've all heard about this in the news, and we talk about it in our public health classes. But the government's decision to try and save cost in the city of Flint and switch the water supply from the Detroit River to the Flint River is what's sort of spurred the Flint water crisis, and their inability to sort of control for the chemicals that were found in the water led to these led to the lead pipes rusting and causing all of the high lead levels in Flint. And this was in part due to cutting costs for the government and sort of just complete negligence on the government's side to ensure that the water was treatable and drinkable for this predominantly African-American community. And we know that even once concerns were raised among community members, there was not much that was done. And I'm still not sure that the community has been completely heard in terms of what happened and getting some sort of, I don't know, apology and more for sort of what was happening to them. So lead is just one example that's tied to paint or pipes. The other one that is a big one is air pollution, which I know a little bit more about. But air pollution is, of course, harmful for our health. It causes all sorts of things, respiratory issues, cardiovascular issues, problems with lungs, skin, and much of this has to do with the particles that we're breathing in. And I think we're hearing, more about particles and respiratory effects now with diseases than we have before. But these particles can come from anything from fires to power plants and vehicle exhaust. So they really have large negative health impacts for various communities. And we can attribute, from the health standpoint, 3 to 4 million deaths worldwide from just air pollution. And I'm just going to show a couple slides here, again, that really are pointing out it's not about some about where you live and it's some about your social class and your income, but race has a large part in this as well. So this map is showing that people of color in general have a greater burden from air pollution than other communities. So comparing to non-white to white populations, you can see that in all but 4 states, people of color are exposed to roughly twice as much particulate matter, these particles, than white people are. So even if they're living in the same state, people of color are exposed to much more air pollution, and potentially these have very large health implications. And you can see Pennsylvania is not doing very well. And Pennsylvania does not do well at all in terms of air pollution data. And I was actually surprised by this when I moved back 2 years ago. So of the top 25 cities in the US ranked for air pollution, Pennsylvania has 5 cities that are ranked in the top 25 for particle pollution. So this is not a good thing. Pittsburgh, Johnstown, and Lancaster are tied for 15th, Philly and Harrisburg, York, Lebanon. So we have 5 cities in the top 25 for high particle pollution. And if you think about demographics in some of these cities, potentially lower income or communities of color as well. And this slide, I think, also makes a really important point. So this was a study that was done by University of Minnesota and Washington, and they wanted to see how the difference between who creates the pollution and who is exposed to the pollution. So if I'm creating my own pollution, well, you know, I guess I've done that to myself. But what they find is that white populations and white communities are more likely to actually create the pollution. So here you can see non-Hispanic white Americans, they create more pollution than they're exposed to. So they have 17% less pollution than they produce. Whereas white communities are then creating all this pollution, and those who are exposed and suffering from air pollution are minority communities. So Latinx Americans and Black Americans, they're exposed to up to 63% more pollution than they actually produced. So, you know, I don't know how to phrase this other than that, you know, people are not creating this pollution themselves. It's being forced onto them by other communities who are not actually having to deal with the repercussions of the pollution they're creating. And just an example from the Latino population, again, if you think about various parts of the US, especially in California, and in Pennsylvania as well, thinking about fracking and oil and gas refineries, if we think about sort of the health burden of air pollution, a lot of this is concentrated, and a lot of the research has been concentrated on asthma, especially among school-age children. So where you have oil and gas refineries very close to elementary schools, or highways very close to elementary schools, many of these schools are low income or minority populations. And so children are being exposed to disproportionate amounts of air pollution based on sort of their social and economic class. And then one thing of thinking about the future, there was a paper that was just published recently, and we talk a lot about sort of maternal mortality and race and public health. But if we think about climate change and increasing temperatures, the study showed that as temperatures continue to increase and we have really high temperature days, it's actually tied to premature birth, ranging from 8.6 to 21%. And we already know that Black mothers are 2.4 times more likely to have children with low birth weight than white women. And so again, if we sort of think into the future, with climate change, with heat, with air pollution, these things are going to only sort of continue to exacerbate the health issues among African American communities and Latino communities. I'm going to wrap up just quickly with sort of current politics about air pollution, and that's really just that we are supposed to review our air pollution standards every so often, and the current administration has sort of disbanded the particulate matter review panel and removed all independent scientists except one, and appointed people who are actually involved in industry. And so if we think about air pollution, the things that we could be doing to sort of reduce air pollution exposure among vulnerable groups, we're really moving actually in the wrong direction. And this is sort of more in my field, so I've been keeping up with it, but there's been a group of scientists who have created their own independent review. And it was just, I think they have until the end of June to get people to sign on to it. And essentially what they're calling for is lowering the standard. So saying that we need to be exposed to less particles, fewer particles, to adequately protect our health. And this again ties directly to more vulnerable populations, and that by not reviewing these standards, we're actually ignoring vulnerable populations and going against what we're set out to do in terms of the government and protecting people's health. So this is a really big thing that's going on right now in terms of air pollution that if you're interested in, you can look at. And in terms of COVID-19, I think we've all heard on the news and have been reading about the differential impacts of COVID-19 in the US, especially on minority communities. And here's just a sort of simple image that shows potential reasons why this is. And one of them, at least from the environmental side, is a potential greater exposure to air pollution. So there's some research now being looked at into the intersection between COVID-19 and air pollution. And if they are tied together, we already know that minority communities have higher exposure to air pollution, and this could also make them more vulnerable. I'll just sort of skip over that. So lastly, to sort of wrap up the hopefully not too long lecture piece, is that there are good things happening. It's not all terrible. And I think part of it is that, you know, our communities and policies, we do have the ability to create change, right? And you've seen some of this in the news more recently with Standing Rock Reservation and the Dakota Access Pipelines. Again, another minority community that was being taken advantage of. Social movements and people coming together can, very difficultly, but they can make a difference. Other smaller sort of things that you probably haven't heard about is just communities coming together and thinking about their own exposure and their risks. So communities in Dallas and Fort Worth have been creating sort of air pollution monitors and networks so that communities can become involved and invested in what they're exposed to and potentially influence policymakers. There are lots of environmental justice groups, one called We Act, which is based in New York City. And I think what's happening with the current Black Lives Matters movement is helping, obviously, to bring awareness to the structural racism as it also extends beyond policing. So I think, sort of to summarize what environmental racism is to me, I should maybe make that caveat, but really it's something that I don't think we think about as often as we should. And it is, of course, systemic and structural discrimination against communities of color. And it's impactful because it has disproportionate impacts on these communities, both physical and mental health outcomes. I didn't touch at all on mental health, but exposure to these environmental pollutants, along with cultural racism and other forms of racism, which you'll hear about, all compound together to really disproportionately impact these communities. So I think maybe I'll sort of hopefully get some input here. Sort of what can we do? I think, you know, my work is focused a little bit more globally and a little bit less on policy, but sort of putting this together has definitely reinvigorated me into thinking about what we can do as a community. The first thing, of course, I think is to be aware that this exists, that, you know, communities of color, minority communities, low-income communities are, of course, at a disadvantage. I mentioned Professor Reddin's course. I don't know when she's teaching it next. I think it might rotate on housing and race at Gettysburg College. So I would encourage any current students, if you're interested in this, to sort of think about that class and become members of our own communities. How can we become involved in discussions that are pertinent to our own communities, whether that's in Gettysburg or nationally or internationally? So some resources, some books, websites, and then I'll just stop there and hopefully we can have a good discussion.
So, well, first of all, thank you very, very, very much, Megan. This is exactly what we were looking for. And of course, you were able to be concise and exhaustive at the same time, touching base on redlining and all of those things that make a huge impact on environmental racism. So, again, thank you very, very much. And I'll be able to get all of the links from Megan in order to send a resource sheet along with the link to the video recording later on today. So right now, we are going to open up the chat to a discussion. You can ask questions, you can make a statement if you want to unmute yourself to make a statement. If you're a faculty or a community member that has experience in working in or around environmental racism, please, this is your opportunity to share. Now, again, just like in class, either Megan was super detailed and gave you exactly what you needed and you have no questions, or we're going to start with one brave soul to ask a question. All right, from Laura. Megan, can you talk a little bit more about local issues in Gettysburg that we should be thinking about?
Oh, thanks, Laura. I was gonna have to start calling on people. Yeah, I think I'm not sure I know the exact answer to that. I have not thought about this as much as I probably should have in terms of the context of Gettysburg. I think we all sort of get wrapped up in our own work life bubbles. But I think it's something that we could potentially explore as a group. And I sort of noticed that I might have freaked some people out about the older buildings in Gettysburg. But yeah, I think that there are places in Gettysburg where potentially lead paint is a problem and they could be impacting minority groups more than the white population. And I don't know the answer to that. But I think it would definitely be something that I'm open to, especially after having put this sort of talk together, is figuring out what is of concern in Gettysburg or in Adams County or this region, and maybe other, like I have a feeling that Professor Redden might know the answer to this, or other people on campus. So yeah, I'd be interested in hearing from others if they know more than I do about this.
So Maddie made a statement that said related to pesticide exposure in Adams County agriculture, knowing that we are a predominantly agricultural community. Could you speak to that?
Yeah, this is something that I've been wanting to explore since, so this is my finishing my second year at Gettysburg, or returning to Gettysburg. This is something that I'm actually really interested in terms of pesticide exposure, especially as it relates to the general population, but also to the farm workers, because we know that they're particularly vulnerable groups of population that we need to protect. So I've been slowly asking around campus and the community about pesticide exposure and potentially looking into that, either doing a study or just sort of learning what's happening. So right now I can't talk much about it, but I do think it's potentially a concern, and something that I would really be interested in more and looking at in more depth. So yeah, Maddie, we can potentially talk. And again, others, yeah, there are all kinds of different environmental exposures that I didn't talk about, but pesticides is definitely one of concern.
All right, we have a question from Brittany. So do we have to make better medication to help those who are already exposed to lead and then lessen the exposure for future generations? Like, is it a two-part solution?
Yeah, I think the problem with lead is that it's twofold. I mean, we really shouldn't have, especially children, being exposed to these high lead levels in the first place. Um, and oftentimes lead, because it is detrimental at such a low dose in terms of how much you're exposed to, it can go unnoticed for a very long period of time and cause ill effects for children as they continue to grow up. So I think the first part is that houses really do need to be tested for lead paint and high lead levels. And if they're unsafe, it needs to be fixed before anyone lives there, but especially before children live there. I think that the impacts of lead are irreversible. So a potential medication is not going to help once a child has been exposed. But there is some potential for increased screening. So children who are going for their checkups, which hopefully they are, and encouraged by community members and outreach staff to go get their checkups, should be tested for high lead levels. And if we know that children who are living in lower income neighborhoods or who are African American, they should in particular be screened for lead. And so increased screening could help catch some of the exposure to lead earlier on and hopefully reduce any of the potential health effects.
Megan, our next question comes from Sarah. Is there any information about COVID testing accessibility in different areas by race? What kind of inequality exists in this area? And are there more privileged communities getting greater access to testing contact tracing?
Great question, Sarah. So I think probably like everyone on the same page here in that I don't know all that much more than anyone else. But from what I've been reading, I mean, Pennsylvania's data, if you look at it stratified by race, I mean, they only started publishing that maybe a month ago into the pandemic in terms of who was getting even just cases of COVID-19 by race, and then you'll just see that most of the data has no racial category. So even just cases are very unclear about race, and that's because people weren't asking or weren't paying attention. But my guess is that there is an inequality, and I can't be for sure. There shouldn't be, but if it, as the US policy and healthcare is tied to insurance, if we have communities who are underinsured or uninsured, they might be more likely to be low income or of non-white races, and so they might be less likely to go and get tested if they think it's going to cost, and they might delay treatment for COVID-19. So I think that there are definite sort of differences between income and racial groups for testing and for treatment. I don't know the specifics, but I'd say yes.
Teresa asked, what actions would you ask the Gettysburg College administration to consider, be they lobbying, donating, or other actions in order to protect the migrant farmer population? I guess I could assist with answering this. The Center for Public Service has done a great job at establishing and maintaining the college's working relationship with the migrant farmer population. And so I think that we can heed to and ask CPS, what areas do our migrant farmer community need assistance from the college? from the Painted Turtle Farm to offering other assistance services. CPS, kudos to them, have a real thumb on the pulse of what the needs and areas of assistance are for our migrant farmer populations. And so I think we can take a beat from them in how we as an institution can help that community if in fact the environmental and the pesticide issue in agricultural areas have a huge impact on them. So on to the next question from Anna. Are there any laws or structural guidelines put in place, like zoning laws, that prevent the building of large power plants or non-environmental friendly companies in low income areas?
That's a great question. And again, housing and policy are not necessarily my expertise, but as far as I understand, and anyone can correct me here, I think it varies greatly by state in terms of zoning laws and regulations. So some places have better zoning laws that would prohibit companies in general from being in residential areas, whereas other states have much fewer regulations, and therefore, neighborhoods are not necessarily protected against shopping centers in general or just environmental factories. So I think that this varies greatly across the US. If anyone else has insight into that.
I'm going to go on to the next question. It's from Logan. How do we manage the production of harmful chemicals such as those being produced in Louisiana? Do we stop production or try to come up with better substitutes for chemicals?
Great question. So I think, well, and so in the link, which I can share with Monique, the 3-minute video, the chemical company that actually makes this harmful chemical at the big plant in Louisiana is actually based in Japan. So, you know, these very large corporations who are in charge of making chemicals and producing them might not even be based in the US, and I think are very difficult to combat. Not saying that we shouldn't, but they have a lot of power and a lot of money. And so whether these chemicals are going to continue to be made, I think changing that would be very difficult, but I think distancing those chemical plants, if they have to be made, or, you know, we can't change them in the immediate future from areas where people live, is probably the next best step. So don't build your chemical factory in someone's neighborhood. And we read a book about this in my epidemiology class, about Tom's River, which was in New Jersey, and sort of this chemical plant that was polluting the water in actually a predominantly white neighborhood, and that it just went unnoticed by community members. And so I think at least creating some solution to try to prevent these companies from producing and escaping some of the regulations that should be in place in terms of then dumping chemicals either in the air or in the water to impact health would be a good first step. But yeah, it's incredibly challenging.
From Matt, do you think that we will be able to regulate polluting industries to healthier levels, especially in communities of color, or do we think that we should start finding ways to eliminate these pollutants from communities altogether?
Yeah, so I guess similar. I mean, I think all of the evidence that I sort of tried to show today points to the fact that both low income and communities of color are disproportionately affected. So we should, of course, be most concerned about them. That being said, we should think about everyone equally. We wouldn't want to just shift chemical companies from one community to the next community. That impacts everyone. But I think paying attention to what's happening in the administration right now, there's so much going on in the world right now, but I think you'll see glimpses of article headlines about what the government is doing to roll back some EPA regulations. So a lot of things that were put into place under the Obama administration are currently sort of, and quietly, I think, being dismantled by the current administration. So giving tax breaks and sort of lifting off regulations from industries who are polluting and saying, now you can pollute more. We had regulations in place for a reason, which is to protect communities and their health, but these things are actually being turned back. And so I think a lot of this is governments, both local, statewide, and national, but paying attention to what's happening and seeing if we can make a change with our votes and with who we elect in order to ensure that some of these policies remain in place, and then create new and better policies would be something that I think we should really pay attention to.
Thank you. And from Macy, do environmental issues like wildfires and rising ocean levels count as the same type of man-made environmental racism? And is there a way to address them other than preventing climate change?
That's a great question. Yeah, and I didn't touch on this, but I think so Hurricane Katrina, of course, is the obvious example here for thinking about an environmental, not man-made issue that significantly impacted low-income and communities of color. And part of that was due to the regulations around housing and where African-American communities and low-income communities had set up. And so, yeah, I think climate change in general is going to continue to impact, again, disproportionately. So communities of low income and minority communities much stronger than it is going to wealthier communities. And this is sort of across the world. So globally, those people who are already living in sort of, day-to-day lives, or who are nomadic, or who rely on fisheries for food, all of these things are going to be impacted by climate change. And so communities that are already marginalized are going to continue to become more marginalized as climate change continues. And I think we've seen with examples, the wildfires in California that were around LA and all of these mansions, they got a lot of press. And I think in part due to the fact that we were looking at celebrities potentially having their houses burned down in multi-million-dollar mansions. And I think some of this has to do with the way we think about popular news media. So why didn't Flint get the same media coverage as some of those wildfires, or wildfires taking place somewhere else? So it's all, intertwined and a bit complex, but I think we need to think about climate change as a whole, but also what things we can do to protect vulnerable communities, knowing that some climate change is gonna have an impact in the future.
Thank you. Well, I want to make sure that we are cognizant of time, because there was someone that said something. Maddie, and I'll share this, but I want to be mindful of time because we have a town hall this afternoon about the opening of school in the fall, but I will read Maddie's comment. Related to engaging the local G-Berg farming community with CPS earlier this year, I moved into a neighborhood in South Seattle notorious for being directly under flight paths to and from Seattle Airport. So like a vertical fence line community to the air and noise pollution. At my local community center, I saw a presentation from the University of Washington Public Health researchers who had engaged the local community in monitoring air and noise pollution around South Seattle, which is generally more ethnically diverse and lower income than the rest of the city. The community center was a great conduit for getting this info out to the public, engaging what's needed, volunteer translators too, and encouraging local community action. And then she said, thank you. So again, everyone, thank you for joining us today. As I shared, we are going to follow up with a recording of this video along with the fact sheet and the links that Megan shared. So thank you and have a good day.